Dr. Diane Heinman, publisher of Natural Nutmeg magazine, and we are here together with Dr. Ayala Connell-G. She is a physical therapist, and her PhD is in neuropediatrics, an exciting field. It sounds fascinating to me. She's also the director and practice manager of the Institute of Integrative Manual Therapy that's here in Bloomfield, Connecticut. And we're going to be talking with her a little bit today about everything that goes on here. It's very exciting. It's a really unique multidisciplinary practice. So tell us a little bit more about what a patient might experience when they come here.
Well, the Institute of Integrative Manual Therapy is a holistic healthcare center. Our foundation of what we do is integrative manual therapy, which is a really remarkable way to gently, non-invasively work with the body to help make better posture, better mobility, greater circulation, better drainage, which all in all gets the person to a place of better health, which of course means less pain. We integrate in with a manual therapy comprehensive nutritional wellness, where we help to find ways for the person to live healthier and use nutrition and diet to help reduce inflammation and just overall make them be healthier and feel better. We have some really remarkable modalities like heat laser, things like that can really help to reduce inflammation in joints and other parts of the body. We do a lot of lifestyle coaching on how to live more naturally and live healthy, and we do a lot of community education to teach our community how to live better and feel better.
Right.
Yeah.
And you have practitioners that have been here for a very long time.
We do.
Yeah.
We do. Our practice has been around since the early 80s.
Wow.
It was founded by Dr. Sharon Gimateo, my mother, who is a physical therapist, and her doctoral work was in the field of adult neuro and traumatic brain injury. And our co-founding partner, Carol Gordon, who's a physical therapist, and they're a great team. And we've been around for a long time. We have a group of practitioners who have been working with us for over 25 years. We have a lot of expertise here. And they are largely physical therapists that do manual therapy and, cutting edge physical therapy. But we also have massage therapists, body workers. Our medical director is a chiropractic physician who also does acupuncture and nutrition. We have a great team here.
Yeah. So I think a lot of times people think physical therapy, they think they're going to come in and just, get their body moved around a little bit and that's it. But really when people come here, the approach is so comprehensive because it's not just physical therapy, it's integrative manual therapy, it's nutrition. You could be getting a massage one day, and you could be seeing a number of different practitioners. Yeah,
we have, I really do believe the best way to explain it is, we see so many clients that come here that are frustrated, that have been around the block. They've gone to so many different practitioners around the state, around the country, around the world. We have an international patient population. And they just haven't found answers, and they're so complicated, so complex with their issues, many different issues. And we have clients that have been coming to us over the span of a long time. They'll come and see us through the end of a particular issue, and then, God forbid, they have another accident or injury, they're back again because they know that we can help them.
Right, and that's great, but that's a testament to the practice for sure.
It is. Word of mouth, for sure.
Yeah. So tell us a little bit about what makes this center different from other practices or other practitioners.
One of the ways that we're really different is we take a team approach. We're very collaborative. So if someone comes into our practice as a client, they don't just get one therapist. They get a team of therapists that are really focused on how to get that person to a better place, to feel better, to function better, to have a better life. That's something that we've always prided ourselves in, is working in a team.
And I think people actually are having so many issues with healthcare. One thing that definitely comes in, I'm sure, is the cost. So are any of the services covered by insurance?
Absolutely. We offer physical therapy out-of-network billing, and we also offer out-of-network chiropractic billing. But the work that we do is largely manual therapy, and we integrate nutrition into it, and of course our comprehensive physical therapy. So many of our clients submit to insurance companies, and many of them get reimbursed depending on their policies.
Right. That sounds great.
Yeah.
Well, we're certainly going to recommend everybody to come down and see you.
Thank you.
Thank you.
Welcome to the Institute of Integrative Manual Therapy. We are a holistic healthcare center where we offer manual therapy, comprehensive nutritional wellness. We have lifestyle coaching and natural living. We have a lot of community education in natural living, in how to be healthy, how to be natural. We work collaboratively. We have a team of many different disciplines that are all naturally alternatively minded and work together to help our clients get to a place of optimal health. So this is a typical manual therapy session. For Matt, he's here for symptoms like low back pain, occasional shoulder pain. So right now we're working on his biomechanics. And biomechanics is really all about joint alignment, how the joints sit on each other, the pelvis, the sacrum, the low back, spine. So Nancy is actually working on trying to mobilize some of the joints so that there's better alignment, better posture, which thereby would help to decrease some of his pain that he feels when he's exercising and after he exercises. The manual therapy that we use, an integrative manual therapy, is very gentle. There's nothing that's aggressive, invasive, pain-inducing about it. When we mobilize some of the joints, we're really trying to feel the bony joints that we're working on, and then using different types of techniques in integrative manual therapy to help create the best posture, the best joint alignment. And as a result of this type of treatment session, we would expect to see better movement, better bending, better lifting, better standing, walking with greater ease, and then of course the pain would be reduced because the movement and the posture was improved. We have many different kinds of clients here. Matt's more orthopedic related issues are one category of clients, but we have clients that come in for more digestive issues, where we would use manual therapy to address the digestion, and that might be techniques to help promote better circulation to the abdomen, where largely the gut resides, better drainage of toxins, helps to reduce inflammation, and again, trying to create better mobility of the different parts of the digestive tract, which would help to promote better function, and then the person's symptoms would be reduced. We treat people that have cardiovascular issues, people with headaches, children with all kinds of sports injuries, even things like growing pains, things that are so common, so typical, but not necessarily normal, not necessarily something that is reflective of healthy development. So using manual therapy, we can help to restore normal movement, normal posture, better circulation, better drainage, that can then help improve overall the way you feel and the way that you develop as a child. We also work with geriatrics, people that are elderly and maybe have difficulties moving, or maybe other types of issues, digestive, cardiovascular, inflammation. They might have a lot of swelling in their legs and their extremities. So trying to promote better drainage using the different manual therapy tools that we use is really helpful to make the person feel better and function better and overall be healthier. So this is a typical class at the Connecticut School of Integrative Manual Therapy. This classroom is where we instruct people how to perform manual therapy techniques in our type of manual therapy program. This particular class is on the cranial system. This is the third level of our cranial series, where we teach our students how to treat different parts of the head and the central nervous system to help reduce restrictions in the cranium, which can help to reduce headaches, help to reduce jaw pain, it can help to promote normal brain function. Lots of people today have headaches, they have sinusitis issues, all kinds of cranial symptoms, and the techniques that we teach in the cranial series is about how to promote health and function and mobility of the cranial system, which can help then to reduce symptoms in the cranium, including headaches, sinus issues, overall to get better drainage of the head and the neck. There are many students in this class that, in this program, that take our classes. Some of them are clinicians, physical therapists, chiropractors, massage therapists, and then equally many of our students are lay people that are interested, fascinated by integrative manual therapy and are wanting to learn how to do it for themselves, for their family, for their community. We have a certification program in our school, and many of the students that take our class are working towards that certification.